to announce that the operation of the Family and Victim Services Office has been transferred to the Department of Recreation and Youth Services, and a new Crisis Intervention Services Unit has been created that is designed to better serve the needs of our community. The transfer is now official as of yesterday evening, when the City Council approved legislation that allows for the transfer of these funds and the establishment of this new crisis unit. These past few weeks have been difficult for our community, and we have acknowledged the flaws and failures that exist in our current systems. We have also vowed that we will do everything in our power to rectify the inadequacies and systemic problems that plague this community. Today, we take a major step toward implementing much-needed change and revamping the way we will respond to nonviolent crisis situations. The goal of the new Crisis Intervention Services Unit is to create a non-law enforcement, comprehensive community response to all homicides, as well as to all calls involving mental health, domestic violence, and other related crises. The unit will be split into 2 teams. Team 1 will be a comprehensive homicide response team, responding to all homicides, while Team 2 will deal with all mental health and domestic violence calls. Both teams will be on call 24 hours a day, 7 days a week. While we are making this announcement today, I want to stress that the planning for the special units began well before the events this past several weeks. It would have been impossible for us to develop a plan of this magnitude in just a few days. The fact is, planning for the homicide response team began almost a year ago. We've been looking at national models and engaging with area stakeholders to find out how we could best serve and protect some of our most vulnerable residents. We know that a coordinated response to crisis calls in our community is essential to making sure that these calls for help are handled appropriately, and that those in crisis are given the type of care they need. By mobilizing highly trained professionals, including crisis counselors and social workers, we can better ensure this happens and avoid the type of tragedies that have occurred. We have worked hard to listen and to examine both what our community has and what our community needs. There are many individual services and service providers trying to make a difference, and we want to organize, coordinate, and join efforts so that we can have a meaningful impact and actually move toward change. The creation of this consolidated unit of efforts will help us to achieve the first step, which is ensuring all of the city's efforts are coordinated and working together. We have had pathways to peace. For more than 20 years, and the Family and Victim Services Office for 30 years. We have partners like WROC Against Gun Violence Coalition, RIT and the New Serve Project, Strong and RGH emergency departments, and community groups such as Rise Up Rochester and Save Our Youth, and many more who have collaborated with and been brought together to work in a more coordinated effort. We know that responses that are non-enforcement based work, and we are looking to bring all of these efforts together, mobilize, and get out to support our community. We know that the professionals who have long worked in facet and victims assistance will continue to do their work in serving the community, but doing it together in a unit that is connected to, but not led by, law enforcement. That's what the community has asked for, and that's what other national models have proven work. We will increase our accessibility by working from this location across from the transit center and in a facility supported by support services and supportive personnel. This location was recently the longtime home of SUNY Brockport's social work program, and is fitting to be the new home of our combined community services programs. I want to thank Vice President Lightfoot for his vision and his tireless commitment to these efforts. Council members Lupien and Harris for their ongoing work to get the right people to the table to plan and organize this effort, and for all of City Council for their steadfast support of this critical function. I also want to thank Dr. D.T. Ogilvie, Dr. Cephas Archie, and Mike Soretto and the 911 team. And lastly, my team here at DRISE, especially the Pathways to Peace team, who have all pivoted quickly and assembled this new crisis intervention services unit. And now I'd like to ask Council Vice President Willie Lightfoot to say a few words about the work he's been doing and the creation of the Comprehensive Homicide Response Team. Thank you.
Thank you, Commissioner Torres. Good morning to each and every one of you. I want to first start off by respecting and honoring and condolences to the Prude family and respecting and honoring them in this space. Thank you. This is good news today. It's very good news in lieu of all of the civil unrest that we're having in our community about this comprehensive community response to our citizens, providing quality services to some of our most vulnerable citizens. Upon taking office in City Hall, and I want to thank the mayor who, once I came to her with this idea of the Think About It campaign, the WROC Against Gun Violence Coalition, she immediately jumped on it and said yes. We realized that there were gaps that we found as we began to bring people to the table in this work, especially around homicides within our community. There are many agencies who do this work, and they do a great job, and they're out there every day. Too many to list, but I don't want to start naming names and forget someone, but just to name a few: Pathways to Peace, WROC to Peace, Save Our Youth, and Project Serve, just to name a few, are out there on a regular basis doing this work every day. But what we found out, which just seems to be common in our city, is that oftentimes these partners work in silos. So what we begin to do with the WROC Against Gun Violence Coalition is to begin to bring all of the partners to one single table so we can have one voice around this topic and begin to work on solutions. That was over a year and a half ago. I began to travel around to the National League of City Conferences, and this was a conversation that's happening nationally all across the country. At many tables with many elected officials, trying to figure out ways to bring about services to victims of homicides, victims that are in crisis. When I began to tell individuals in other cities some of the work that we were doing here in Rochester, folks were very excited about the work that we were working on, and they were looking very patiently waiting for us to come up with our motto. Coming to city, I found it very difficult at one point in time to try to put this piece together. And then Dr. D.T., Dr. Ogilvie came together, started helping us. Many have worked on this project over the last year and a half to put together a comprehensive community response to homicides. As a result of that, we begin to look at models from the Bronx and Brooklyn, where they have a mobile trauma unit, and they have actually several. And we put forth an idea to bring forth our first mobile trauma unit here in Rochester. We used forfeiture funds, and we purchased a vehicle that we're getting ready to launch very soon to have a mobile trauma vehicle that will be responding to the scenes to help deal with the traumatic effects that gun violence has within our entire community. So that's one aspect of this comprehensive community response plan. Then as we begin to look at our partners, which we have over 70 partners involved with the WROC Against Gun Violence Coalition, I came with the idea to Commissioner Torres. And through her diligence, she began to work to help Dr. D.T. and all of the rest of our partners come together to begin to create this plan to have more of a comprehensive response to our community. As we began to put that together, we were on the verge of completing it when we had this particular situation happen within our community with the Prude family. As a result of that, we start hearing the calls for a different response, not a police response, but a more sensitive response from social workers and individuals who could respond to these type of calls. And what we found out is that the city provides these services currently already. But one of the barriers to that is the fact that some of the policy practices and procedures may be a little antiquated, and we may need to fix some of those policy practices and procedures to make sure that they are addressing the situations for the time that we're living in now, 21st century way of doing things. And so Commissioner Torres is beginning to look at that and begin to redesign that. And what we also found as a barrier is that some of these services are provided at the public safety building, which, as anyone can see, especially now, that's not a place that I think that a lot of the citizens necessarily feel comfortable going to with these type of issues. So I thought it was a brilliant idea that Commissioner Torres has to consolidate these services into this building, first of all, which is more accessible to our public, second of all, which is more user-friendly to our public, as well as it provides a new breath of fresh air for the individuals and more attention and attentiveness to the individuals that do this work every day. So we can look at this as kind of a one-stop shop for crisis intervention services for our community. We're very excited to be able to provide these services to our community. I want to thank City Council, the Mayor, on behalf of City Council President Loretta Scott and all of City Council for supporting a 9-0 vote for this on last night to move these particular disciplines to Department of Youth and Recreations. Also, this is also a study that was done in our Baker Tilly study that was done years ago that also identified that those services should be moved to DRIs. So this is something that's backed up by facts, it's backed up by best practices, and it's backed up by community demand for these type of services. We're trying to work and move into a direction where what happened to the Prue family will never happen. And not just the Prue family, but any of the other homicides that we've had all throughout the years. We average 30 to 40 homicides a year. That's 30 or 40 families that are hurting, that are traumatized. That's a community that is traumatized 30 or 40 times a year, on top of all of the shootings that we have as well. So we're hoping to provide these services to the community on a consistent basis so that every homicide, every family is given the same quality service. And that I believe that, as we've seen the statistics show, that decreases crime. So with that being said, I am in fully support of this. This is good news for our community. This is a step in the right direction. We know that there are many more steps that we have to take. I'm also one of the 21 members on the Race Commission. And we're looking at all of these systems as well, too, all the systems, with a racial equity lens. And how can we fix policy practices and procedures so that we can make them have a better impact on marginalized populations and people of color. So we've expedited our work in the Race Commission. We've recommitted ourselves to doing some more in the very near future, and we believe that we're taking steps in the right direction. So thank you.
And we can answer any questions that you might have. Yeah, these services for this new crisis intervention unit are not going to be solely focused on youth. We know that most of the crimes and many of the violent impacts that happen in the community do involve youth, and so that's certainly something that we're well equipped to deal with. But it's not exclusive to that. This is a unit that is going to respond to all ages that have these issues. So to answer your question, if this unit was available during that time, it would have been on the scene.
And how would things have been different?
Well, the whole goal of this is for things to be managed, mental health crisis to be managed by mental health professionals, people who are trained in the de-escalation and the ability to address those immediate health needs. This is an example of a health crisis, and they would have been the equipped people to respond, to de-escalate, and to refer and connect an individual going through that kind of crisis to the right service, whether that's medical service or otherwise, but not a jail. Not a jail referral, but a mental health referral.
So they would have been dispatched to that scene?
They would have been dispatched to that scene.
Well, this team acted, though, would they intervene? Would they actually step in?
So FIT is a stakeholder. We're all a comprehensive part of the response. We will all be working together to make sure that we have all the right professionals and all the right people at the table and in response. But we know that individually, all of our responses have been limited. They've been limited in hours, they've been limited in the capacity, the number of professionals available, and they've been limited in their procedures and how they do that. Making sure that the scene is safe for these response professionals is something that will be a key part of the protocol. And they will be trained and they will receive the right training and have the right skills to make an assessment of how and when they should intervene and when something really does cross over into a crisis that requires a different response.
In speaking on the county level, just further explanation with FIT in the dollars that they want to invest in this in order to get clinicians, in beefing it up, ramping it up, is it going to make a difference? I mean, as far as getting this program to where you want it to be effective?
Well, by having more resources available in our response teams that can go out has to make a difference, because right now that doesn't exist. Right now, calling for support at 3 a.m. isn't going to get the mental health professional that someone would be able to respond. So by having these services in place, then we will be able to have the right professionals respond at any time and be available and accessible. So we've had a lot of these services in the community. They just haven't been widely accessible. They haven't been fully funded and supported and coordinated in a way where we can all get the call and know who is going to respond and have a coordinated team of people responding. Not one person, but a team of people responding. No. So this crisis services intervention team will have paid professionals that we hire. Part of the transfer of funds that came from City Council to the department for this was to be able to add staffing. So there was a specific, purposeful adding of staff that will happen, and these will be professionals. These will be social workers. There is also going to be all of our community partners who bring their own set of professionals who are paid by them. So whatever organization is a member of our teams, they will be a part of the response. And some of those organizations do use volunteers. For example, for some of our homicide response teams, organizations like Rise Up Rochester and others use volunteers. They use peers, people who have gone through what those families have experienced, to be able to connect to them, to be able to relate to them. So there'll be peers. There's all kinds of levels of responders that the community has weighed in on, and that they feel that a coordinated, comprehensive team is what's needed.
How many people are we talking about as far as, I guess, what's the crew size of these teams?
Well, that will depend, but I would imagine that they would be, as large as 7. Maybe 8 people who would be able to respond, depending on the team and the situation. So we've done a lot of work with the WROC Against Gun Violence Coalition members. As Councilmember Lightfoot said, there are 70 different agencies and organizations and individuals involved in that. Now, obviously, they won't all be there, but we will have large representation for each one of these types of responses to make sure that the people who are responding can get connected to support services that are meaningful for them and right away.
How different are these teams from like the FIT program? Or are they going to be working together?
Again, we'll be working with the county and the FIT team to talk about how we can make sure that what they're doing in the expansion is something that complements and works with what we're doing in the expansion. So we will be having further conversations about when they'll dispatch people and how they'll be a part of that particular team. But the goal is to work together and use all of the resources that the community has to bear.
You mentioned 2 teams for the operation of this. How is that set up? On-site teams and response teams?
Yes, so there will be 2 teams. One team will be responding to homicides, as Vice President Lightfoot spent a lot of time talking about how valuable it will be for the families and communities, and that team will be specialized and include stakeholders that really can support that work. And then there will be a team that responds to mental health and other related crises. I'm sorry, how long before this starts? So we are working hard to have this ready as soon as possible. So we're, hoping to be able to launch this, in October. And so we're working along those lines right now. There is a coordinator that will be responsible for mobilizing those teams. That coordinator has been hired and will be beginning on Monday. So the ability to get the teams assembled, the policies and procedures in place is what we're working on, very quickly. I mean, everyone, all hands are on deck. Everybody's working to get these policies in place as quickly as possible. The vehicle that we'll be using for responding is here, is ready, is available, because this was something that we had been working on. So the vehicle not only, had the time to be ordered, it's here. It's here, it's getting ready. And so we'll be able to launch this as soon as possible. We will put out a notice when that availability will happen. So when it's ready to go, we will let the community know exactly when it's ready to launch.
I think one of the concerns is what happens if we get a call at 3 a.m. tomorrow morning? This program is not ready to go just yet. How is the response different at 3 a.m. tomorrow morning than it was back on March 23rd?
Well, we do know that the county has also talked about changes that they've made to the FIT team. And so, it is, we can't answer for that team and exactly what their logistics will be, but we know what the county has stated as well. And the hope would be that based on all the experience that we've all had as a community with this occurrence, based on all the things that we're trying to put in place, that everyone would be acutely aware that we need to mobilize what we do have in place today. And put those professionals in place faster than we would have done prior to that event.
What type of relationship, particularly with the mental health crew, what type of relationship will they have with police? I'm assuming police will still have to be responding in some form. And what's the hope for who gets there first?
Well, we will be working very closely with law enforcement, because we always have in all of our responses that have been centered around having other people respond than law enforcement. So we've been doing Pathways to Peace and FACET and victims assistance for decades already. So it's not abnormal for those professionals to respond, make an assessment. If they believe that law enforcement is required, they will call them. They will call them